Welcome, everyone. Am I muted? I hope you can hear me and see me. My name is Rebecca Perkins, and I'm one of the outgoing co-chairs of the National HPV Vaccination Roundtable. I'd like to welcome everyone to the 2024 ACS National HPV Vaccination Roundtable National Meeting. This week, you are joining us for a celebration of 10 years of Roundtable magic, and I feel very privileged to have been here since the very beginning, when it was just a group of enthusiastic HPV passionate individuals. And I don't know if you've seen or will probably see later on the fantastic video that Tina Turpin put together that sort of highlights all of the accomplishments of the Roundtable over the past 10 years under the direction of Dr. Debbie Saslow, who has sadly moved on to other HPV vaccination work, but really most of the accomplishments between 2014 and now were under her absolutely incredible leadership. And HPV vaccination rates have risen from under 40% in 2014 to almost 80% today. And while the Roundtable cannot take all the credit for that, I like to think that because we represent a group of national organizations who are the influencers of the vaccinators and the vaccinees, I would like to think the Roundtable did have a part in that. So please prepare to be inspired by all the work that has been accomplished over the past 10 years in partnership with all of you, and gain knowledge in how we can continue to innovate together to prevent HPV-related cancers. A few housekeeping items throughout the session today. Please post any comments, reactions, or needs in the chat. Any questions you have for the speakers, please post into the Q&A box, and the presentations and recordings of today's session will be shared. Also, please subscribe to our newsletter through the website and our socials for more information on new resources, videos, and more. If it's one thing that Roundtable members like to do, it is educate and make resources to help get things going and make things better. So there's always new resources coming around. Before we dive into today's session on how HPV vaccination is cancer prevention, which we all know, but everybody needs to know, we want to thank everyone for joining us and for all the work that everyone has done over the past 10 years. This celebration is for all of us and for the next generation, which we hope will grow up HPV cancer-free. Our session today is on equity in HPV vaccination, and we'll hear from Dr. Jennifer Irves on HPV vaccination and equity. After the presentation, we'll move to 2 panel discussions and then have a moment for some resources and next steps. So the first presentation is Dr. Jennifer Irves. She is an associate professor in the Department of Health Policy and Director of Community Engaged Research in the Office of Health Equity in Vanderbilt University Medical Center. And I will now turn it over so you can hear from Dr. Irves. Welcome.
Good morning. Thank you for that introduction. I am very excited for the opportunity to be here today for this 10-year celebration. I'm equally excited to be a part of this important discussion around HPV vaccination and equity. Next slide, please. So it is no secret, as it's already been stated by Dr. Perkins and the rest of the individuals who have spoken unto this point, that the HPV vaccine is safe, it's effective, and it saves lives. With over 135 million doses given to date, rates still remain suboptimal. Next slide, please. As we noted on yesterday, rates have stalled for 2 consecutive years. This leaves many at risk, free from protection, as this is a life-threatening disease. So it's important that we get our children, as well as certain adult populations, vaccinated. Next slide, please. So where do the disparities exist when it comes to HPV vaccination? We know that they are present and they persist, but which of these groups? Next slide, please. So as we look at the data, we see that these are the disparities at a glance. By far, I will not go through all of these, But just for example, in the 2022 NHIS survey, among children aged 9 to 17, as we can see, girls were more likely to receive one or more HPV vaccine doses. Very similarly, with the NIH Teen Survey 2023 data, we see that among adolescents aged 13 to 17 years, those living in rural areas are less likely to be vaccinated compared to those living in urban areas. And as we go down to lists, whether it's geographical, certain groups, immigrants or refugees, we see that disparities exist. And it's not just when we look at the vaccine numbers, we even see disparities when it comes to knowledge on HPV and associated vaccines and malignancies. So for example, we know that Black individuals are less likely to be aware on knowledge in HPV and associated vaccines and malignancies, along with other racial minorities compared to white persons. And very similarly, there was a systematic literature review conducted where minorities were less likely than whites to follow through on the HPV vaccine series. Next slide, please. So when we think about inequities, we know that that's driven by inequity. Immunization inequity is the systematic difference in access to HPV vaccination. This leads to unavoidable and unfair differences in health outcomes. And particularly here, we're talking about HPV and the associated cancers. This is primarily driven by what we call social determinants of health, and they are a major driver of these disparities that we see. These are the factors of where a person lives, where they work, where the children play. So if we look at this figure, we know that these are major drivers in these disparities. Next slide, please. So when we look at this particular figure, we see that many barriers exist when it comes to equitable HPV vaccine distribution and administration. There are other areas I could mention, but I really wanted to highlight the data and operational challenges, the access challenges, and misinformation and vaccine hesitancy. So for example, when we look at data and operational challenges, we think about the limited data quality, the limited ability to assess individual programs, the lack of interoperability between health information systems to share data, just to mention a few. In access challenges and misinformation and vaccine hesitancy, I really wanted to highlight a few that really emerge in my particular research when it comes to engaging the African American and Latino community in some of my recent work. When we think about the structural barriers, many parents have highlighted the lack of workplace flexibility to come to the office or the convenience of the areas where they can get their children the vaccine, for lack of a provider recommendation or poor communication. Transportation issues have emerged. When we think about misinformation and vaccine hesitancy, we know that our communities of color are commonly targeted with disinformation around vaccines, which really came to light during the COVID-19 pandemic. We also think about the misinformation that's commonly spoken and other areas that influence vaccine confidence to the point that people want to wait and see. They're constantly looking for the data. Even in our recent work, when we ask them why they haven't completed the vaccine series, they wanted more information like, what is happening with the vaccine? We got the first dose. Where are we now? I want more information. Also, when it came to around completing that series, parents wanted to know, okay, my child had a reaction. Why was that? You said that there were limited reactions as a provider. Now we're seeing that we're having these reactions. What is happening with my child? And ultimately, we have this big thing when it comes to mistrust. When we think about the healthcare system or government, researchers, even pharma, these are critical barriers when it comes to individuals wanting to uptake the vaccine and even complete the series, especially if a child has had a reaction and that trust was built, but then it was semi-lowered when these things happen. Next slide, please. So as we know, Dr. Brewer and team came up with this model of behavior and social drivers of the vaccination framework. And it shows that when you look at this, that immunization inequity is present because of the barriers that I presented in the last slide. So if we think about the vaccine confidence or the health worker or lack of a health worker recommendation or inconsistent communication, or even the practical issues that were mentioned, how can we achieve our national goal of 80% if these barriers are in place? Next slide, please. Furthermore, if you look at the HPV vaccine timeline that has been presented, these existing barriers and disparities will hamper or could hamper our ability to meet these guidelines. So if you think about the vaccination guidelines or the projected near elimination of cervical cancer in high poverty and low poverty communities, if we don't get get the immunization rates up, this can be an outcome. Next slide, please. So now we have a call to action that we must have health equity. So this is the state in which everyone has a fair and just opportunity to attain their highest level of health, including awareness and access to immunizations. And I'm going to call it and say not just access to immunizations, but also to communication and information around HPV and the vaccine. Next slide, please. This is a vision for us as public health practitioners, researchers, medical professionals. We all share. But if you look at these quotes on the screen, this vision is not just shared by us. It is shared by parents, adults, anyone who would like the vaccine. They share this vision too. For example, it's just we need reasons and assurance from the provider that everything is going to be okay. Yeah, and I wish that offices were open during later hours, which would make more sense because not every parent could take a day off. The only thing that could motivate me to continue the remaining 2 shots is access to educational materials. Next slide, please. So what does HPV vaccine equity mean? Though this is not a comprehensive list, 3 areas are important to target. We must build access. Is that host vaccine clinics, maximize Medicaid enrollment, support alternative settings, offer after-hour and weekend visits, give reminders. When we think about supporting alternative settings, I will say in some work that we completed among African-American child parent dyads, there's a lot of work to be done to educate around these alternative settings, their roles in immunization, and the services that they provide. Parents are concerned to a certain degree on the competencies of these individuals to provide vaccines. Or with the health department, especially among African Americans, because it's associated with the government, there is a question around trusting this entity to provide vaccines. When we think about building confidence, it's so important to engage partners. We talk highly of providers because they are a trusted information source, but there are others, whether it's community-based organizations, community health workers, they are in the community. They have an ear, they are trusted, and they can play a role in building confidence in vaccines. Offering culturally appropriate education is very critical, from the language being able to relate. Do the visuals relate of the images that we provide? All of these things are very important. The messages must be effective when we create our materials and our campaigns. And then we have to increase our footwork. And what I mean by that, a lot of times we depend on the providers when the parents are in the clinic to have these discussions, but sometimes we will have to go to the community to provide education to our communities. And the last thing is building demand, advocating for policy change. Many of us on the call are in that area, building confidence in our providers, and also to be culturally sensitive is very critical as we move forward, and being able to track vaccination in real time. So if you look at all of these efforts, it's very critical that we revisit our current partners' infrastructure and build multi-sector partners so that we can address these inequities related to HPV vaccination. Next slide, please. So very quickly, I wanted to highlight a couple of things of the work that we have been doing. So the first one is around HPV Facts. We know that mobile health has been studied among a few of our colleagues when it comes to addressing HPV vaccination. Particularly in our group, we developed a mobile web app called HPV Facts to study if we give parents tailored information prior to their clinic visit, in addition to questions that they can ask the provider, can we actually increase HPV intention and uptake? And from our results, we had a 38% increase in HPV vaccination in our study arm. And we just received our 1-year data, so we want to see where we are in terms of rates. So I hope to have more information following. And then also with psychosocial factors, we found that attitudes and knowledge was very critical when it came to uptake, particularly how people feel, which is what we knew determines if they get their child a vaccine. So we look forward to getting more information about that. Next slide, please. The last thing I wanted to highlight is the importance of community-based organizations. They are very critical as in this area of time as we want to move forward when it comes to addressing HPV vaccination uptake. The ground is fertile post-COVID-19 pandemic. And so our team actually developed this model on how to engage community academic partners in research. And so we're in next phases of planning on how to implement this model to actually increase HPV vaccination uptake. And I wanted to highlight Wipeout Cervical Cancer of Alabama, Dr. Scarency, while they're not directly engaged in research in some of their efforts, but they are actually taking a lot of these principles that we highlighted and they're implementing it in the work that they're doing. So I wanted to really highlight that model that people should look at moving forward. Next slide, please. So some key takeaways here. I wanted to really let people know or to remind people that disparities exist and there are multi-level barriers or inequities that exist that fuel HPV vaccination disparities. Multi-level approaches are necessary, including interventions, their components, and stakeholders. And community leaders, members, and patients must be at the table to develop a HPV vaccination health equity plan. Thank you.
Hi, everyone. I am Dr. Ashonda St. Jean, and I am a board certified OBGYN for over 25 years. And I have the honor and privilege of moderating our equity panel today. First, I have to thank Dr. Urs for such an incredible presentation and really grounding us on the importance of equity, shared vision, just care, the social determinants of health that impact vaccinations, access, and education. So she has laid the groundwork for us to continue that conversation today. So we're going to start with a panel discussing HPV vaccination equity among special populations. I would like to welcome Dr. Molly Eierschauer, Assistant Professor, DNP Project Coordinator at the University of Louisville School of Nursing. And then we'll have Synovia Moss, National Project Manager, Good Health Women's Immunization Networks, part of the National Council of Negro Women, Incorporated. And last, we'll have Dr. Daisy Morales Campos, an associate professor at the University of Texas Health Science Center at Houston School of Public Health in San Antonio Regional Campus. So we would like to hear more about their work during the panel, but if you would like, please read their full bios and there will be a link in the chat so that you can read them. So welcome, panelists. Thank you so much for joining us today. So we're going to get right into this conversation and this discussion. So each of you, can you please come off mute and can you tell us a little bit more about your work? Whoever wants to go first, just go for it. And what keeps you passionate about health equity and HPV vaccination?
I can start.
Wonderful.
Oh, it looked like I froze. Sorry. So I work with federally qualified health centers to increase HPV vaccination, mostly among Latinos here in Texas. Right now, I have an R01 that's looking how to improve vaccination rates using like an implementation science lens. So I'm currently working on that, hoping to make improvements with my collaborators and just try to help increase rates for that particular population.
Wonderful. And Ms. Moss, would you like to go next?
Sure. First of all, thank you to ACS and congratulations on the National HPV Vaccination Roundtable for the opportunity to join you all with today's panel. So my work through the Good Health Wins initiative, led by the National Council of Negro Women, is centered around increasing vaccine awareness, access, and building vaccine confidence within African American communities. The National Council of Negro Women, NCNW, we're very unique. We are an organization of 37 national women organizations with the mission to lead, empower, and advocate for women of African descent, their families, and communities. And so we focus on education, advocacy, and community service while really, I would say that we really address a lot of issues around social justice, health disparities, and economic equity. So within our network, we have about 2 million women. So we are very committed to making sure that we can improve the lives of our families and children. So the Good Health Wins Trusted Messenger Network, we actually we really are an outbirth of the COVID work that we've been doing and helping with the pandemic response. And so we put together a very extensive infrastructure which now includes not only our 2 million women, but also the Divine Nine organizations, our large Greek letter organizations. And so we have a reach now to about 4.5 million. We take a very systemic approach to the work that we do, and we're really focused on, I call it the heels, the boots, and the sneakers on the ground, because we've been able to look at this work from the lens of women, from our families, and also working with children as we are now working in we have a teen component to the work that we're doing. And so we really want to focus on increasing knowledge, resources, and support around vaccines, but especially around the HPV vaccination. Long story short, what keeps me passionate about this work in health equity and HPV is the significant impact it has on impacting certain cancers, especially cervical cancer, which we know disproportionately affects Black women. And thank you so much, Dr. Urbis, for that amazing presentation, because it helps us to understand our why in doing this work.
Thank you so much. And our last panelist, but not least, Dr. Eyal Shao, please tell us a little bit more about the work that you do and what keeps you passionate about HPV vaccination.
Thank you. Well, my background is actually as a primary care nurse practitioner, providing care to patients across the lifespan. And that's part of what originally stimulated my interest in doing more work on this topic, is seeing systemic stigma and discrimination in healthcare providers, explicit and implicit bias toward minority populations, leading to suboptimal care. So I say that as a preface to now, as I'm more involved in research in my current role, I first began looking at HPV and cervical cancer in my doctoral work when I looked at knowledge in cervical cancer, high-risk sexual behaviors. And at that time, since I started when I was 8 years old, the HPV vaccination was not available. However, as I've evolved and as my work has evolved, I focus primarily now on sexual and gender minority populations, or LGBTQIA+ populations. And we're really looking at community engaged approaches to cervical cancer risk reduction for sexual and gender minorities. And we've been looking at going about that several different ways. Of course, one of the primary ways is by actually getting in the community. So we partnered, for example, with the Louisville Pride Foundation here in Louisville, and given vaccines even at Pride events, given vaccines at the Pride Center, where there are more safe spaces, and as well as education in those type of spaces. We also worked with healthcare providers, trying to increase their knowledge and comfort providing care to LGBTQ+ patients, and helping them to tailor their care to become more culturally appropriate, and helping them to be aware of how much their implicit and explicit bias can really affect the care their patients receive. And not only that care, but then their health outcomes, and how that can even inadvertently be a huge barrier. So, and most recently, our project that actually is finishing up right now, we've been looking at not only HPV vaccination, but high-risk HPV self-sampling for primary cervical cancer screening at home for sexual and gender minorities, trying to look at both primary and secondary prevention for cervical cancer. So I say that to say that our research team's long-term goal is really to develop interventions that target sexual and gender minorities who have a cervix, and as well as helping our healthcare providers to increase HPV vaccination, decrease those cancers, and increase cervical cancer screening.
Thank you so much. You know, I think what we got a lot from the takeaways we got from Dr. Irv's presentation is kind of the framework, right? In terms of building access, building confidence, building the demand, right? And we know that sometimes there can be some vaccine hesitancy that occurs. And so what I want our panelists to further discuss is, what does advancing HPV vaccination equity mean to you? And what does achieving HPV vaccination equity mean to you? And anyone can just jump in.
Well, I'll just go ahead and share what may echo actually a lot of Dr. Irv's presentation. These are not all my original ideas, since they've already been stated. She covered really all those bases, but I think of things like availability, affordability, accessibility of the vaccination, and doing that through a community engaged approach, asking people what are their actual barriers or facilitators to vaccination, and then trying to build targeted interventions that the community helps us to develop to reach different communities where vaccination is lower. I think also that we have to not forget our healthcare providers as a piece of the puzzle. We know that healthcare provider recommendations are one of the major drivers of actual completion of vaccination, and helping our healthcare providers not only to do that at different types of visits, so not just at a wellness visit, but with different types of patients, those who may need catch-up vaccination, or maybe with a patient that's coming in for COVID, even if it's not appropriate that day, to remind them, hey, it looks like you haven't had HPV vaccination yet. So those are the things that make me think about how we can start to advance equity. And, you know, I think unfortunately, we still have work to do to achieve that equity. But to me, that equity would be that world where no matter who you are, that you actually have the same likelihood of having completed HPV vaccination and the same ability to complete HPV vaccination as anyone. And that is, in a very broad way, I guess, how I look at that, because we know that equity is a huge challenge, and that's why we have to really address healthcare disparities specifically as we think about building interventions and coalitions.
Thank you. And I think one of the things you touched on is the importance of cultural sensitivities. And Ms. Moss, I want to kind of give you the mic at this point to talk to us about all the work that you're doing with Good Health Wins and kind of how you address equity in vaccinations.
Thank you. One of the key takeaways that I tell you that so resonated with me from Dr. Irby's research is that community leaders, members, and patients must be at the table as you develop these HPV health and equity plans. And so at Good Health Wins, just want to lift up a couple of examples of things that we've been able to do. So putting it in, contextualizing it, we came into this space with our COVID response. But we very quickly saw the importance of helping communities of color to understand the value of vaccines across the lifespan. And within that, even targeting some of the work that we're doing with our teams. So for example, we have, when we talk about community engagement, in our groups, they say, we want a union. We don't want to be engaged. We want to know that we're going to do this work for the long haul together. And so we call it our community union, our trust building opportunities to build community. So since COVID-19, we started bi-monthly community of practice sessions that have over 85,000 participants. And we average around 750 to 1,000 people who are coming on the line to learn more about building vaccine competence. We recently hosted 2 national town hall meetings with almost 3,000 African-American parents, students, community members specific to HPV. So we know that we have this wonderful audience, and now we have an opportunity to bring specific attention around HPV. Additionally, we currently have about 2,000 mini grants on the ground with our chapters across the United States. And so our Good Health Wins, we have a National College Ambassadors Program, and we are so excited that we are now launching our National Teen Ambassadors Program with Top Teens of America. And we'll provide 300 mini grants to teens and their groups and organizations specific to their demographic, and we're going to target a lot of campaigns around the HPV work. And then the other thing that I'm very excited about, next year we're launching our Good Health Wins National CBO listening sessions in urban and rural communities across the U.S. We're identifying 25 cities that we will go to, and when we go into a city, our goal is to create vaccine competence hubs. And so we use the data, we do a lot of demographic data with our groups and organizations, but we are really positioning organizations at the community level to build vaccine competence. And of course, we're going to include in our data gathering, data analysis, information around teens, parents, their thoughts, and really focusing on HPV. So we really try to get low to the ground, but very organized in a systemic approach to make this ongoing education for communities of color, especially the African-American community.
Wow, so impressive, so impressive. That sounds like a robust, strategic and intentional strategies that are really kind of impacting change. Dr. Morales Campos, one of the things Dr. Irvs talked about is, again, language and barriers, right, to care. And so can you please kind of jump in on the conversation about, what advances HPV vaccination equity and what are some of the strategies that you've implemented as well?
So just going off of Zenobia's discussion about increasing confidence for overcoming hesitancy among parents. So one thing we're doing with our project, which focuses more like on a healthcare system level, is working with providers to help them have a better conversation with parents and their child patients to help overcome barriers that we've seen regarding vaccine hesitancy over the HPV vaccine. So part of the project involves a provider education piece where we're using like an AD, it's called an academic detailing booklet. And we have a facilitator that will actually help them practice how to have the conversations or what conversations to have to overcome 3 of the types of determinants that we've seen in the literature that pertain to vaccine hesitancy. So just being able to prepare the providers to be able to have difficult conversations. So when they come up in the actual healthcare setting, they're better prepared to have the conversation and hopefully help the parents overcome whatever hesitancy concerns that they're bringing up in the exam room.
Thank you. And it sounds like you're compiling a toolkit for providers. And one of the conversations that's always been had is that what Dr. Irvs leaned on was being a trusted informational source. And for historically, providers has always been that trusted messenger, but sometimes that can sometimes be askew. So having that toolkit is probably very, very helpful to the providers and for them to kind of navigate those difficult conversations that can be had. So one of our last questions I want to pose to the panel is, what policies would you like to see implemented to improve HPV vaccination?
I'm going to jump in so for us, we have different HPV research studies that we have focusing on different populations. So I've seen, like, for adolescents, there's ways for them to access it so our parents don't have to pay like the fee to cover the doses. But we have seen like more barriers come up in Texas for like young adults to get the vaccine. We used to have a program called the Adult Safety Net Program. The program still exists, but it no longer covers the HPV vaccine for this particular population. So that's like one access barrier that's come up. And as part of our project, our team tried to strategize like how to get this population access with our health centers. So we did find that Merck does have like a reimbursement program for health centers where they can, if they purchase the vaccine doses and they use it, Merck will reimburse like whatever stock was used. So that was one way we were able to get around this policy change, like with, being able to access it through this program and then it, being dissolved like really suddenly. So just trying to figure out ways for certain populations to be able to still get the vaccine. I mean, we did have a way, but then it got dissolved, which I don't know why, but trying to figure out ways to be able to get the dosage, because it could be very expensive to certain populations that might not be able to afford it otherwise.
Okay, great. Thank you so much. And so, Ms. Morris, I'm going to hand it over to you. Tell us about what policies would you like implemented that would help improve HPV vaccination? Ms. Moss, are you
Oh,
are you?
I am. I'm sorry. So one of the things that many of our national organizations are doing now is that many of them already have days on the Hill. And so one of the things that we are asking them to do is to look at specific legislation that would be helpful, whether it be at the state level or the national level. And I would say generically, we really would like to see increased funding for public health campaigns. It's really important that all parents are educated on the importance of HPV, but especially if we could do some targeted campaign around HPV vaccination equity work in communities of color would be very helpful.
Okay, I completely agree. And so last but not least, Dr. Shire, what policies would you like implemented?
So I think there's two things that come to mind. First, at the healthcare system level, I think we need to be sure that we have training for caring for SGM populations or sexual and gender minority populations. And that needs to go out to all staff. So not just maybe primary care providers, or it needs to be from front office staff to everyone, because we often know that the first experience at the healthcare office is the front desk. And if you're misgendered at the front desk, you already have started out perhaps now with a bad experience, which makes you much less likely to be able to really even take in health information and maybe make the best decisions. So I think that's really important. And I think also that's training on HPV vaccine recommendations, once again, starting again from staff all the way through healthcare providers across the spectrum, that really focuses on cancer prevention as the way to promote HPV vaccination, and also bundling the vaccination with other vaccinations, rather than one thing I see happen here for our preteens is that because the state requires other vaccinations at the age of approximately 12 years old and does not require the HPV vaccination, it often is that and the HPV vaccination, which may leave parents with a different connotation of that, the importance of that vaccination, or if it's not required by the state, then it must not be something significant. So trying to help overcome those by having educated staff, I think, can make a difference. And then just creating those safe spaces where everyone is welcome, whether that be members of the LGBTQ community or parents who are members of the LGBT community. This really affects all different types of families. So we need to think about those welcoming and safe environments.
Thank you so much. So we got some questions in the chat, and I think we have time to get into a few of them. And Dr. Irvs, I still have you on the panel, so I'm going to take it to my advantage, and I'm going to include you in answering this question as I ask all of the panelists. This is a question. What is the one thing each of us must do now to improve equity in HPV vaccination? One thing. All right, let's go. Dr. Irvs, please, if you don't mind joining us, I'd like to hear your response to that question.
So my first thought is policy, but what's passionate and dear to my heart is the community engagement piece and being culturally sensitive. As we move forward, the populations that I showed on the screen, each of those cultures are different and they perceive healthcare, vaccinations in a certain way. And it is our duty to be able to connect and identify with the reasons why people aren't getting vaccinated and to help in identifying a viable solution that will actually work. And so essentially, I feel like that means us taking a step back and reevaluating where we are, not just from our perspective and our roles, but actually where the community, the patients, the parents, the young adults, where do they stand right now, and come up with a plan and set forth some reasonable goals moving forward to achieve HPV vaccine equity.
Thank you. Thank you so much, Dr. Irvs. I'm going to pass it to Ms. Synovia Moss. What's that one thing? Tell us, what's that one thing we can do now?
I would say the one thing we can do now is to be a true committed advocate, that we are willing to share information, willing to provide resources, and that we make that personal commitment to really reach out to utilize our influence in an impactful way.
Thank you so much. And Dr. Morales Campos?
I was going to say, just listening to Dr. Irvs, just taking into account historical context of like our populations. Every racial identity has their particular history that's impacted like how they see medical care, from Native Americans, African Americans to Latinos. So I think it's very important for people to understand that, to understand like where they're coming from and why it might be so difficult for different groups to be hesitant towards vaccination. Everybody has their own history. So I think understanding that and then also communicating it to providers or research staff, like the people that are, you know, responsible for getting the vaccinations, you know, administered, or however you want to call it, it's really important for them to grasp that and to be able to understand like where folks are coming from to make any changes.
Thank you so much. And Dr. Aya Shower?
Yes, and this is a little bit of a repeat of what's already been said, because the first thing that came to my mind was also to really work with our communities But another thing that I thought about in relationship to that is listening to our communities and avoiding assumptions, because working with communities and then actually listening and avoiding those assumptions can be two different things. So I would just kind of add that piece.
Yeah. Yeah. So being an active listener, right? And validating the concerns and the experience and the histories of our patients. Those are all very important in kind of understanding, relating, and also hopefully vaccinating, right? So I think we have enough time for one more question of our panelists. Thank you so much. How can we better understand the intersectional identity and how this influences HPV vaccination decision-making? If anyone wants to jump in on that question.
I
I was,
think,
oh, sorry, go ahead.
I think we have to change how we collect data. And we're gonna have to be more intentional. So we know a lot of medical entities now are starting to collect this social determinant of health, population health data, which I think that puts us in the right direction moving forward to gauge a better understanding. But I think we're gonna have to complement that with work within the community, because that data is not gonna be enough. So we're gonna have to go to the community. That's where that increase your footwork comes into play. And we're gonna have to go get the data so that we can make proper equity plans moving forward.
Thank you so much, Dr. Urs. And Ms. Morse, would you like to tell us what your thoughts are on that question?
I didn't hear the question, that's why.
Oh, let's do it again. So how can we better understand intersectional identity and how this influences HPV vaccination decision-making?
I agree. It's really about going directly to the community to get this data. And then, for example, we at the council, we understand our positionality and the important role that we have to be, so that this data is going to really be changing, life-changing. And it also may look and sound different than what we are expecting when we really analyze this data. So I think it's been so important for us to be partners at the table and to be able to provide access in a different way, that being at the table provides another lens of looking at and analyzing all of this information.
Thank you so much. And again, community partnerships, bi-directional communication, having that testimony be heard, being active listeners, addressing concerns, answering questions. And sometimes what I find in my work is that sometimes you have to have the conversation several times. It has to be repetitive, and that's okay. Again, with the work that Dr. Morales Campos is doing and creating that toolkit, right? So you already have a playbook in terms of how you can have those conversations in a respectful manner, right? And culturally appropriate, with respect and humility towards one's values, beliefs, and also their history, because that impacts decision-making as well. I wanted to make sure that every panelist has the ability to give us their last thoughts before we close out this panel. This has been such a really robust conversation about equity and vaccination, and I'm so grateful to be a participant with all of you. So last words, everyone.
Well, on behalf of the council, we wanted to say thank you for this amazing partnership and the opportunity to be a part of the roundtable. And our goal is to be a part of this for the long haul. So we're in.
Thank you, Ms. Moss.
I just want to echo and thank ACS for their dedication to being aware of health disparities and engaging different individuals and diverse researchers and opportunities as we look to move this work forward.
All right, and Dr. Morales Campos?
Just to say also thank you for inviting me to be part of the panel with such a great group of people. And just because I didn't get a chance to say anything about the intersectionality thing, but just also, since I'm a researcher, just getting more training out there for researchers to be able to use that intersectional lens, like when we do studies. Because I think if more folks did that type of work, we'd have a, how we were saying, like a more robust way at looking at the issue that we're trying to make change in.
Thank you so much. And Dr. Irvs, you weren't a panelist, but we made you a panelist. You're part of the team. You gave us a phenomenal presentation. Would you like to give us your last words and thoughts?
I just think after listening to everyone, it's so important that we're in this together. It's going to take a multi-level approach, as we've all heard across the panel, and we have to be in it for the long haul. So I tell everybody, get ready. We have a lot of work to do.
There you go. So you heard it from Dr. Irvs. I want to thank everyone for our amazing panel on vaccination equity and for speaking to us today. And thank you for taking time out of your busy schedules. And thank you everyone for attending. So our second HPV vaccination panel, equity panel, is going to discuss addressing equity with non-traditional providers. So I would like to welcome to our panel Dr. Parth Shah, Assistant Professor, Hutchinson Institute for Cancer Outcomes Research and the Cancer Prevention Program in the Public Health Sciences Division at Fred Hutchinson Cancer Center. And then we have Dr. Alice Chen, Associate Professor, Roseman University, Board Certified Pediatric Dentist, and a Fellow of the American Academy of Pediatric Dentistry. And then we have Karen Schwen, Texas School of Nurse Organization past president, National Board of Certification of School Nurses, Board of Directors 2024 to 2027, and subject matter expert for addressing HPV vaccination in Texas schools, the Project ECHO model. We would get to hear more about the work that they're doing in the panel, but if you would like to read their full bios, the link will be in the chat. So welcome, panelists. Let us all assemble and have our fruitful conversation. Thank you so much for joining us today. So we're gonna do kind of like a round robin. So can you tell us more about the work that you do and why you have chosen to be a champion of HPV vaccination? Let's start off with Dr. Chen, please. Thank you.
So I'm a practicing pediatric dentist, and I see patients and their parents every day. I believe that dental professionals should be a strong voice in this fight against HPV vaccine advocacy, because as dentists, we're already looking in our patient's mouth every day for early signs of oral and oropharyngeal cancer and talking about HPV infection already. In the past 20 years, the connection between HPV virus and oropharyngeal cancer has solidified and strengthened. Today, more than 90% of oropharyngeal cancers are caused by the HPV virus. And again, it's that same message. When parents and patients are hearing a clear and strong recommendation from across all the medical professionals, they feel more comfortable. They're more likely to go get vaccinated. And that's why I feel really, really passionate about this cause.
Thank you so much, Dr. Chen. I'm going to have Dr. Jump in next, please. Okay, while we're trying to figure out those technical difficulties, Ms. Karen Schwen, can you please jump in and tell us where your passion arises from?
Sure. I identified early on as a school nurse that many of my coworkers and the nurses who reported through me when I worked in a local school district really very much had a lack of knowledge about HPV vaccination and about HPV virus itself. And so initially my involvement became around wanting school nurses in particular, to just know more about the HPV vaccine. And now I recognize how important that vaccine is in being able to reach all students and parents. We have a very captive audience. School nurses have access to parents on a daily basis. And so being able to share that information about a vaccine that particularly is not required in the state of Texas. And so making sure that those recommendations for the vaccine are available and that we're able to get to all students within the state. Actually, school nurses reach all students across the country, but particularly in Texas, that we're able to reach students of all colors as we are able to be their school nurses.
Thank you so much. And Dr. Shaw, are you able to join us or come off mute and join the conversation?
Yeah. Hi, everyone. Thanks. Sorry, my internet's a little unstable right now. Well, excuse me, I am a pharmacist. I'm also trained as a behavioral scientist, and a big portion of the research and work that I do is around how to improve vaccination access and opportunities for vaccinations through community pharmacies. And pharmacies just present a really interesting place to do cancer prevention, particularly HPV vaccination, because of the reach of pharmacies. Around 90% of the US population lives within 5 miles of a pharmacy. That number goes up to above 95% when you take in catchment areas around 10 miles. People also go to places with pharmacies more frequently than they go to any other healthcare provider. So when we talk about community reach, particularly for underserved communities like urban communities or rural communities, pharmacies are an excellent access point. So a lot of the work that I do is focused on how to actually improve patient engagement around vaccinations in pharmacies.
That's incredible. You know, I think it's really delightful to have this panel because there's such a diversity of action, right? We have someone who's in dentistry, pharmacy, and school medicine or school nursing. And so I think we can collectively learn from each of you and also see what strategies you've used to advance HPV vaccination in your profession. Would any of you like to talk a little bit more about the strategies you've utilized to advance HPV vaccination in your roles?
Yeah, so again, as a working pediatric dentist, I see parents and children on a daily basis. And I think as a pediatric dentist in particular, I get to be in that special space where I can catch these families right when the kids turn about 9 or 10 and start talking early about getting vaccinated. And again, serving as that trusted source of information. And then when they come back to see me 6 months later, I bring up the conversation again. I reiterate my strong and clear recommendation, and I find ways to make sure that they do end up getting vaccinated.
That's amazing. And Dr. Shaw, would you like to just detail some of the unique strategies you utilize as a pharmacist in the community?
Yeah. So sort of two areas that I focus my work in relates to using sort of multi-level strategies to address communication issues. So, everyone probably on this panel and attending this conference have been to a pharmacy and have interactions with pharmacists. And, that interaction can be quite transactional, right? You come in, you pick up a prescription or you're dropping off a prescription, you might get some counseling, maybe some other conversations around over-the-counter medications. So when it comes to vaccinations, pharmacy practice, or at least the way that engagement happens in the pharmacy tends to be very reactive. Pharmacists aren't necessarily going out of their way, or pharmacy staff are not necessarily going out of their way to bring up vaccinations in a proactive manner. So a lot of the things that I look at is how do we actually change workflows and the way that vaccines are delivered to be more proactive. So a portion of that is interpersonal communication. How can we train pharmacy staff, not just the pharmacists, but the technicians and the clerks, to engage on vaccine conversations and to identify patients proactively, recommend vaccines strongly, and address questions and concerns as they come up. But then the second part is scaffolding that interpersonal communication is the systems in place, the EHR systems, the reminders, the prompts, how we do scheduling, how can we change that to be very efficient so that pharmacy staff can be on top of ensuring that patients not just initiate vaccination, but follow through if they need a second or third dose.
I see. And then I would like, Ms. Schwinn, if you can kind of give us some kind of unique perspectives that you utilize in the school and what that looks like.
Well, I think of two main avenues, and one of those I've already mentioned as far as educating the school nurses so that they can then share the message with parents. But there's also a real important piece in collaborating with providers. Being able to bring immunization clinics to schools would help with some of the after hours or maybe a Saturday program. Collaborating with pharmacies to be able to provide that on an on-site or in the local communities where families, students and families could maybe even walk to if they don't have a transportation. Most important is that catch up at middle school. We require all students, in order to be in attendance, to have their middle school vaccinations, including the Tdap and the meningococcal vaccine, incoming to 7th grade. So as part of that, bundling that vaccine HPV, and again, communicating with parents, as Dr. Shaw mentioned, is so important in the way we present it, the conversations that we have, not to say, oh, and there is this optional vaccine, but instead, today's the day that your child needs to update these vaccines in order to continue in school, and include HPV right in the middle of the Tdap and the meningococcal. So those are, just some little pointers to be able to help school nurses educate and bring the vaccine to the kids. The second avenue is to be able to educate school nurses through the ECHO process. Currently in Texas, we're in our third ECHO series for school nurses specifically. We run 4 weeks of 1-hour sessions, providing them with continuing professional education credits and being able to educate them on the very basics of HPV vaccination, and also how to communicate that to parents, exactly what to say. We practice some role playing. It's very interactive. And also those notices that go home for kids, for us to be able to specifically identify if they've received their first dose of HPV, to notify when the second dose is due. If they have not received any, to notify that they're due for the first now and then the second one later. So those are all real specifics that we can get into with our nurses.
I just want to just have a little bit of a follow-up question for you. Can you talk a little bit more about the Project ECHO model and what that looks like? There may be others on this call who have never heard of it before or may not be in Texas.
Sure. So the ECHO series, I believe, is an American Cancer Society model that's utilized. I know particularly in the South, we utilize it in a couple different states, but it is a participation via webinar, and it is a very interactive model in that we have a topic for each week. Again, as I mentioned, it's a series of 4 weeks. Currently, we're running those every week. There are times we might run them twice a month. It just depends on the population and who's attending. Currently, we're offering those for community health workers, as well as for school nurses in the state of Texas. And as I mentioned, continuing education professional credits are issued if they do attend all of the sessions. It is very interactive. We look for attendees to be able to present different scenarios that they might be experiencing, maybe some obstacles or some difficulties with reaching a particular population, or ways that they're having maybe an issue with administration and being able to get through to administration to be able to share information about the HPV vaccine. So it's really a learning experience for both those of us that are working with the ECHO and also for those that are in attendance. We learn from each other.
So one of the reasons why I wanted to bring that up is because what ECHO does is it involves clinical vignettes, right? And it's continued learning. And so I wanted that to be highlighted because the work that was done that in this creation of it was incredible. And it is a game changer in terms of education and continued education. So now we want to talk about, how can other non-traditional providers or others in other professions also advocate for increased HPV vaccination efforts? And also, why should they care, right? We're having a conversation with a pharmacist, a dentist, and a school nurse, right? And so they're all on the road, on the road working towards HPV vaccination, access improvement, coverage. And so why should we care? So I'm going to pose that question first to Dr. Chen, and then we're going to go around the table.
So something that is actually very exciting that's happening in Nevada right now is the State Board of Dental Examiners, per the recommendation of our State Cancer Coalition, so Nevada Cancer Coalition, put together an assembly bill that will allow dentists and dental hygienists to actually administer vaccine to their patients. And that's actually something that is happening to multiple states around the country. Hopefully we can get this assembly bill passed so we can actually, increase drastically the number of patients that we see who get vaccinated.
I think that's incredible. When we also share and unify the message, it is better and well received. And so having dental partners like yourself on the road working towards vaccination is just incredible. And I think that's the innovation, right? That's transformative medicine. So happy to hear that. Dr. Shah, would you like to jump in?
Sure, yeah. To answer your question, I'm thinking more recently during the COVID-19 pandemic, like when it became very difficult to access certain types of healthcare providers for routine services like vaccinations. We saw a precipitous drop off in pediatric and adolescent vaccinations during those years. And a big part of that was just because of inequitable access to these preventive services, right? But pharmacies really kind of show how you could change the care delivery model to be more patient-centric, right? When I think about patient-centric models of care, I'm thinking about the medical neighborhood, the fact that patients actually go to multiple providers to get their care and to get their healthcare needs. And pharmacies, much like dentists and nurse practitioners, play that key role in the medical neighborhood. And we saw that during the pandemic, where the majority of COVID vaccinations for both the pediatric and adult populations were given in pharmacies because pharmacies were able to stay open. And so I think when we think about how we provide care, we really should be thinking more holistically and actually put the patient in the center of that universe.
So a holistic approach that is both patient-centric, and I love it. It sounds like you guys are changing the game, and I love it. This is what transformative medicine looks like. And please, Ms. Schwinn, can you please tell us what's happening in the schools? Give us some motivation from the schools.
So once again, I think it's already been mentioned, but we are a trusted profession, and parents will look to us many times on a one-on-one basis, and they may come to us with questions that they might have that they may be a little more hesitant to ask. Sometimes they don't have a lot of time with their providers. There also can be an insurance issue that we can many times help direct them to the proper providers. As Dr. Irvis said, we're all in this together, and I firmly believe that this type of a panel, including dental, pharmacy, community, school nurses, we all can add to the increased vaccination rates. One of the programs that I have been involved with in the Texas communities is the All for Them, is a vaccination initiative that assists schools with planning and implementing vaccine clinics on site. So particularly right now in the Houston area, Southeast Texas. They're very involved. It's a program through the University of Texas Public School of Public Health, and it's funded by CPRIP. So it is, they're able to increase not only knowledge of vaccinations of HPV, but also increase the completion rates for those in the medically unserved populations.
Okay. And so, Dr. Chen and Dr. Shaw, how have issues related to reimbursement and health insurance coverage been addressed in HPV vaccination in pharmacies and in dental practices?
I would say because Nevada dental professionals are not administering vaccines yet, I don't have an answer for that, unfortunately.
Dr. Shaw?
Yeah, really good question. So in all 50 states and US jurisdictions, there is a variation in pharmacy practice, which is unfortunate. So places like here in Washington, pharmacists have very broad latitude with who they can vaccinate and how they can administer vaccines. They can give any vaccine to any age group without a prescription. So essentially, they can authorize a vaccination. That's not the case in all states, which is unfortunate. This also does not create parity in reimbursement, and then that also bars many pharmacists in certain states from actually providing care to certain populations. So you have, state regulations that regulate pharmacy practice that could allow pharmacists to vaccinate with HPV down to the recommended age groups, down to age 9. Other states, you can't do that. But then you also have a reimbursement structure of whether pharmacists are recognized as in-network providers by payers. Certain states, like in Washington, they are. In other states, they aren't. And I think like another caveat is that it's still incredibly difficult for pharmacists and pharmacies to participate in the Vaccines for Children program. If there's any one policy point that I think all of us should advocate for is to lobby the CDC as well as any other agencies around changing how the VFC program is administered, because it is complex and it's very outdated, and it bars significant portions of professionals from engaging in a very important public health program where around 50% of pediatric vaccinations, including HPV vaccine, are administered through that program. So without pharmacists or even dentists or any other professionals being able to access that program, we are in effect in a structure that promotes inequity, right? If pharmacists are only able to provide vaccines to those who are privately insured. So this is a very, very important topic that needs to be tackled.
So what I'm hearing is that these are examples of policy changes that could happen, that could really furthermore have that transformative effect in terms of HPV vaccination. And so when we think about education and providers and traditional and non-traditional, right? We think also about pipeline programs, right? So what's going to happen with the next generation? So what I would like to ask the panelists, would it be helpful or even possible to incorporate some vaccination education in the curriculum of dental, pharmacy, nursing professional schools, so that again, we are graduating the next generation of providers who will also be advocates and champions for HPV vaccination? Dr. Chen, do you want to start off?
I think the answer is yes, absolutely. So all across American dental schools, dental students are learning about HPV's connection to oral and oropharyngeal cancer in their pathology and oral pathology courses. But what is not necessarily being taught is clinically and chairside, how do we talk to patients and parents about it? When do we bring this up? And the answer is that it's so easy, because when patients see us, we are already providing a lot of counseling and wellness education. We're talking about prevention of dental disease, prevention of dental cavities, periodontal and gum disease. We're talking about smoking cessation. So when patients are in that receptive comfort zone where they want to learn how to become more healthy and how to be well, it's really easy to just bring up one more wellness topic. And in what's really amazing that I learned recently is in our local dental school, so this is University of Nevada at Las Vegas, their EHR actually has a special alert right when the patients turn 9. There's a notification that requires you to put in their HPV vaccination status before you move on to the EHR. So that is definitely something that is not standardized across all American dental schools. And I think it will be incredible if we can have built-in features into everybody's EHR.
That's incredible. And that's the game changer, right? Because as most practices use EMRs, electronic medical systems, we need those kind of built-in dashboards that can help the providers to not only ask, educate, but ensure that these patients are getting the vaccination or the preventative care at the right timelines in their lives. So thank you for that. And Dr. Shaw, do you want to jump in?
Yeah. Vaccination practices have been a part of pharmacy curriculum for a while now. At least when I was going to pharmacy school, that was one of the first things that we learned in pharmacy practice was to learn how to administer vaccines, but then to learn all the ACIP recommended vaccines, the scheduling and things like that. And then we were mandated a part of our curriculum to actually go out and give vaccines. So at least in pharmacy practice, this has become a standard part of the pharmacy curricula across the country. Pharmacists have also been providing vaccines for the better part of 3 decades too. It started with the adult vaccinations, like helping with flu vaccinations. And this was actually, it started off as a collaborative model with nurses, because at the time in the early 90s, pharmacists weren't able to provide vaccines. So they brought in nurses into the pharmacies to actually administer the vaccine. So the pharmacy would dispense it and the nurses would administer it. And then later on, practice laws changed to just let pharmacists do it. And now we're seeing a shift now in several states where technicians are now being trained to administer vaccines. So Idaho was the first state to lead that. They're actually doing some very interesting, innovative practices in pharmacy, but they were the first state to train technicians, pharmacy technicians, to administer vaccines. So, there are some very interesting pathways that are taking shape in pharmacy practice in terms of education.
All right. And Ms. Schwinn, would you like to jump in and talk about curriculums in nursing professions as well?
And yes, absolutely. The vaccination information should be shared during nursing school. Absolutely. It's so important that nurses learn all about those diseases so that they know how they can be prevented, including HPV, that it's a cancer prevention vaccination.
Thank you. And Dr. Irvs, I know I'm grabbing you for the panel again, but what do you see in terms of curriculum and pipeline programming and what the next generation should be learning prior to seeing and taking care of patients?
So again, I'm coming from the community perspective based off some preliminary work we've done among African-American parents and their children. And we asked some key stakeholders, actually who's on the panel, their views. And the first thing is, I would say, is that literally the immunization neighborhood providers have to come together with a plan to communicate. And doing that work is very apparent that, they want to know what the other is doing, especially the providers who are caring for these kids from the medical perspective. And then, of course, in some areas, you have the health department or the pharmacy that is really giving care. But it's important that there's a mechanism to collaborate, to talk, and ensure vaccinations are actually updated in a system so that people can track vaccinations over time. That was a common concern across providers, but also from the parent perspective as well. It's like, well, what if my child's rates are over here in this system and then here is school time, and how do I get all these together? That's a big concern. I think the other piece is around education. parents are learning about these. Some areas it may be common for school-based or vaccination clinics. It may be common for pharmacists, but for others, it might not be. So we're in this process of like, we have to teach our medical students and our existing providers how to educate, our parents and even the kids. Because some parents, the kids are playing a role in the decision-making process. And if they're not comfortable going to these new providers, or they feel like they're not equipped or educated, have the skills to give these vaccines, it can be problematic long term. So I think as we look into this immunization neighborhood concept, it's definitely going to have to be we see policy changes, but also communication across the providers. And then we're going to have to increase comfort for some parents to actually accept this new idea of other medical professionals outside of their provider of giving their child a vaccine.
Thank you so much. I think there's a lot to be said about non-traditional, and I don't know if I even feel comfortable using that word non-traditional, because we're all providers and we all are taking care of others and are in service to others in our own ways that are all special. One of the things that did come up, and I just want to address this question very quickly for Dr. Shah, that was in the chat, is what is the best way to try to engage pharmacists to educate parents about HPV vaccine, especially where pharmacists can only administer the HPV vaccine to adults?
Oh, yeah. So great question. So some of the things that I've been developing through my continuing education and trainings around communicating about HPV vaccine also focuses on the idea that, patients are coming into pharmacies for a variety of reasons, right? If a parent is picking up antibiotics for their child or an inhaler or something like that, a part of just ingraining a routine practice is just to check, right? If they're coming in for one vaccine, like the flu vaccine, that is a good opportunity to check, are they up to date with other vaccines too, right? It is the same type of practices that have become ingrained and instilled in best practices in primary care clinics and health systems. We're essentially just taking those ideas and saying, well, how do we actually adapt it into pharmacies? So I think very clear ways, if you are in a state where pharmacists cannot administer HPV vaccine, they can still recommend it. And they more than likely can administer other types of vaccines to those age ranges, particularly flu vaccine. So during flu season, that's a really, really good opportunity for additional education. And, I think it's been brought up, but the fact that if you leverage the fact that a parent or a patient is hearing a positive vaccine message from multiple venues and from multiple providers, that's a very powerful thing, right? A seemingly easy behavior like getting vaccinated still requires a lot of behavioral support. And if you are able to leverage multiple providers in multiple locations, saying this exact same message, that is a very powerful change in an individual's behavior.
Yeah. And I think this whole panel represents transformative care at its finest, because we have all different providers and we collectively working together with the same messaging, right? It's almost like we are undefeatable. So I am just so honored and privileged to hear about what each of you are doing in terms of equity in HPV vaccination, but also making sure there is access and coverage and education. So before we leave the panel, I would like to just give everyone the opportunity to give their last thoughts or takeaways or what they may have wanted to say that they didn't have an opportunity to say. So I'm going to start off with Dr. Jen.
I think for me, education really is the most important piece, because 20 years ago, when I was in dental school, this was not a thing at all. And I have only come to learn about the strong connection and what dental professionals can do within the last 3 to 5 years. And I work in education. So if I only learned this not too long ago, there are thousands of others, people in the dental profession who just, need to educate themselves. And so we can incorporate this for our patients' well-being.
Thank you so much, Dr. Chen. And Dr. Shah, any last thoughts or extra information?
Yeah, I think one thing that I'll leave the group with is, you know, when it comes to working with pharmacies and pharmacists, you do have a group of professionals who are incredibly dedicated and interested in getting involved with adolescent vaccinations. And you may be pleasantly surprised how willing some of these partners are. I'll give one example. One pharmacy that I've had the pleasure of working with uh, took it, the owner just took it on their initiative and started working with the local school districts because she knew that kids needed to get vaccinated in their county. So she just runs vaccination clinics. She schedules it with the schools, shows up with her pharmacy team and provides, you know, I think last summer, she provided around 500 HPV vaccines, HPV vaccines. That's not including of Tdap, meningococcal, other types of vaccines that children might need. And I think over half of those were actually VFC doses that she gave. And you know what she just told me is that like there's a community need. It doesn't matter if this is making me money. This is just something that I need to do. And I think you know the sustainability piece is very important. And that's like where I think we need to do some policy advocacy. But at least building the groundwork in those relationships with those pharmacy practices in your respective states can be a real boon to advancing equity, vaccine equity.
Thank you so much, Dr. Shah. And Ms. Schwinn, would you like to give us your lasting thoughts?
Yes, thank you. Really and truly, school nurses play a huge role in having students to educate as well as parents. In the big message of sharing cancer prevention for the future of our children is so very important. Working with the community, working with all those who are collecting all the data and all the information. Again, working with the partners here, as we've all mentioned, that education piece is so very important.
Well, I want to say thank you to all of the panelists on this panel and the one previous. You are all superheroes to me, and you are all combating, you know, in enforcing equity in vaccination. And so I am so thankful to all of our amazing speakers today on our equity panels. I hope you feel empowered to continue our work to improve equity in HPV vaccination. And now I am going to hand it over to Ms. Kara Long to close out our party today.
Thank you. So we are ready to wrap up. Thank you for inviting me to the party. I'm so excited. My name is Kiera Long. I am the program manager for the National HPV Vaccination Roundtable, and I'm here to wrap up today. Next slide, please. So how can you join the after party? Well, first things first, we are so excited about this panel and today's discussion. We would like to say that we are very ecstatic and we're elated to announce that we will be establishing a diversity, equity, inclusion task group that will be led by our very own Dr. Jennifer Irves today. So we are very excited about that, and you can expect this to launch towards the end of the year. Next slide, please. And also, we always want to keep you engaged. Any oral care providers that are out there who are interested in gaining some ECUs, this is the time where we have Shaping Smiles and Preventing Cancer. This is an oral health professional guide to vaccinations that is helping dentists and other providers or other oral health providers gain knowledge needed to increase HPV vaccination. Next slide, please. And as always, the National HPV Roundtable, we're so excited and we're always happy to share our Emerging Leaders program, which I'm very happy to say that I was a part of the first cohort. But this is an opportunity for early career professionals to promote their career, gain a network and increase engagement, as well as opportunities to address health equity issues and disparities within the roundtable. And we're so excited to announce that we have our 2025 cohort announcement coming soon. So please stay tuned. Next slide, please. And also, we would be remiss if we did not shout out our wonderful advisory board for the Emerging Leaders program this year. We are so excited and thankful and grateful for these individuals for their dedication to helping us find our up and coming emerging leaders. Next slide. And as always, please take the time, just like you did the previous 2 days today, please please fill out this evaluation for us and let us know what you like and things that we can improve on. And the link should be dropped in the chat. Next slide. All right, and please come back tomorrow. Please join us where we'll be discussing HPV vaccination collaborations and partnerships with our very own HPVRT member, Dr. Heather Brandt from St. Jude. So we look forward to seeing you all, and thank you so much.